Chen, Vice President of Research Programs at the PKD Foundation. Thank you so much for joining us today.
Nice to be here, Ella. Thank you.
Of course. So I'd like to talk about the walk you had last month. You had a beautiful and productive 25th annual Walk for PKD to fundraise and to develop research. Tell me a little bit about the importance of the fundraisers like that.
So the PKD Walk is one of our biggest fundraisers, and obviously a good chunk of the money that's raised for that goes to support our research program. It's the largest, the use of our money goes towards supporting our research program. We fund essentially 26 grants and fellowships every year, over $2 million of research funding. And so the walks play a huge role in raising money for that effort.
Tell me some facts about this disease. I know there are multiple forms of it. So I know that one of the forms has a statistic where if a parent is diagnosed with this disease, that parent has a 50% chance of passing it on to their child. And we know that there is no cure for PKD. Can this disease strike at any age? Tell me some more facts that you would like viewers to know about PKD.
Yes, you're correct. There are two forms of PKD. The more common one is called autosomal dominant Polycystic Kidney Disease, or ADPKD. It affects 1 in 1,000 people. And like you mentioned, if you are affected with the disease, you have a 50% chance of passing that genetic mutation on to your children. So this is kind of a generational disease. It affects families throughout multiple generations. So that's the ADPKD. ARPKD, or autosomal recessive polycystic kidney disease, is more rare. It affects about 1 in 20,000 people. Tends to be more of a childhood disease. The severity can range anywhere from prenatal death to kind of milder symptoms going into adulthood. But generally, the two diseases are similar in that they're characterized by the formation of tens to hundreds of fluid-filled cysts in the kidneys. Those progressively get larger, and they lead to deterioration of the functional tissue in the kidney. So the kidney function starts to decrease as patients get older and these cysts start to get bigger. The end result of that for a lot of patients is end-stage kidney disease or end-stage renal disease, for which there is no cure. Patients have to go either on to dialysis or get a transplant. Also, I should mention for the ADPKD, so I mentioned ARPKD affects mostly children. ADPKD, those cysts don't really develop until midlife in most patients. And then they reach that end-stage renal disease stage, usually towards later adulthood, around 60 years of age, kind of on average. Neither disease has a cure, and there's only one approved treatment for ADPKD, no approved treatments for ARPKD. The one approved treatment for ADPKD is called tolvaptan. It slows down the growth of the cysts, so it's not curative. Patients will still end up progressing and losing renal function over time. It just occurs at a slower rate. It also has some drawbacks. The mechanism by which the drug works causes patients to constantly be thirsty, and which also results in constantly having to urinate. So frequent urination as well as persistent thirst are two of the main effects of the drug, which make it difficult to tolerate for some people.
Being that there is no cure for PKD, what options do a person diagnosed have upon receiving the diagnosis?
Yeah, so there's, for a subset of patients with more aggressive disease, that drug that I mentioned, tolvaptan, for ADPKD patients is certainly one that is a good choice for a lot of patients. Generally speaking, there are kind of lifestyle changes that one can make that can have an impact on the progression of the disease. So generally being healthier, just lower BMI levels, so reduce obesity, healthier eating, exercise, things that lead to healthier lifestyles also have better outcomes for patients. Encourage patients to drink lots of water. There's some dietary elements related to salt intake, phosphate intake that can also impact the disease severity. So those are the kinds of things to talk to one's physician about, the kinds of lifestyle changes one can make in addition to potential to be put on tolvaptan.
So an understanding and supportive community must be essential with regards to dealing with this disease and supporting those who have been diagnosed with it. Tell me about the community that you've experienced in your role and how PKD Foundation provides support.
Yeah, so I actually became very interested in PKD personally because my grandfather had PKD. And so for me, going into research, he was kind of my inspiration. But since joining the PKD Foundation, certainly since my grandfather passed quite some time ago, it's really provided me like daily inspiration to get to meet and interact with the PKD community. So I've had a chance to talk to various local PKD communities. I've talked to the physicians that are treating the patients. I've talked to researchers who are developing therapies for the disease. Gone to talk to legislators through the advocacy program that we have, kind of going there with patients who are telling their stories. So all these are super impactful and really, every day I get to interact with these various members of our community, and it's really just reiterates the inspiration that they are to me to make sure that we continue to push towards a cure.
Do you have any standout stories that come to mind from when you've interacted with the people and families dealing with this terrible disease?
I think for a lot of patients, they have the disease runs in their families, and they kind of know that it's a possibility for them. But there are about 20% of cases that these mutations occur, we call it de novo. So they're not inherited; they happen in an individual during development. And so for these people, these diagnoses are coming completely out of the blue. And so every one of them has a different story in terms of how they learned that they had the disease, and what their experience was trying to learn about the disease. Oftentimes, it's a fairly common disease amongst genetic diseases, but not so much that every physician has a strong background in kind of like understanding the disease as well. So there's a significant learning curve for almost every patient, and a period of kind of uncertainty in terms of what the diagnosis means. So when patients share that, it's certainly very impactful.
Would you like to talk about any more fundraising experiences that you've had and the effects that you've seen them create in the community? Yeah,
maybe the thing to highlight here is that the importance of just the research funding in general and supporting the research community. Right now, like the advances in science and understanding of the disease has opened up new doors in terms of therapeutics. So, like I mentioned, tolvaptan, right? So it works in a kind of treating a symptom of the disease, the growth of the cysts, right? But it's not treating the actual cause, which is genetic. And so our genetic understanding of the disease has really led to an understanding that the amount of this protein called polycystin that you have, usually if you're a patient with ADPKD, you have about 50% of normal, right? Because one of the two copies of the gene is mutated. And it turns out that just hovering around that 50% or maybe falling just a little bit below causes these cysts to form. And so a lot of the newest types of therapies that are coming about are related to just increasing the level of polycystin in the body. So just making slight increases to the level of functional polycystin. This protein is formed from the mutated gene. And in preclinical studies, that's been enough to slow, stop, or even reverse the growth of the cyst. So instead of just even stopping it, you can get restoration of actual more normal kidney function, reduce the size of the cyst. And by just maybe making small changes to the amount of this protein that you have in the body. And there are a number of drugs that are designed to just make slight increases to the amount of protein that's there. And these are all kind of novel classes of drugs, two of which are going into clinical trials this year. So it's a really exciting time. And these therapies are potentially curative. So I think that for myself, as well as the PKD community, it's an exciting time to really be pushing for moving these kinds of novel therapies forward. The research funding is part of that. So one of these drugs that's going into clinical trials this year started out, the basis for this drug started out from a very small grant from the PKD Foundation. And that work has just continued over the last decade or so to lead to this drug that's going to clinical trials.
Thank you so much for joining us today and educating the viewers about this disease.
Thanks so much for this opportunity. I appreciate it.